Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today's topic is about vision therapy and what can be done to retrain your eyes when several conditions may exist that are impacting your life. Our guest today is Dr. Moshe Roth. Dr. Roth is an optometric physician, and his practice, Family Eye Care, is located here in Old Bridge. Dr. Roth, welcome to the show.
Thanks so much for having me.
Just tell us a little bit about your background and how you got involved as an optometrist.
Well, I graduated probably longer than I care to admit, probably someplace around 25 years ago. We've got a full scope care practice, and in the past 20 years or so, our practice has kind of evolved more into children's care as well as people who've suffered concussion and brain injury.
Great. Now, you and I work together on several post-concussion patients,
correct.
and that's one of the things we're going to eventually talk about. But if you can explain to everyone what is vision therapy and what is actually the purpose of it.
The purpose of vision therapy is to help somebody regain skills that they had lost or develop skills that they never gained to begin with. Most of us have been to the eye doctor. A child has been to the pediatrician or the school nurse. And very commonly, the way a child is tested is using this old eye chart. This chart is called the Snellen chart. It actually was developed in 1852, so just a couple of years ago. And when the doctor or whether it's a pediatrician or the eye doctor or the school nurse tests somebody, typically what do? They say, cover one eye and read the letters off at a distance, and then cover the other eye and read the letters off at a distance. And assuming that somebody can see distance letters, then the assumption is that everything is fine. If you think about it, where does a child do most of the work? Is it off at a distance? No, it's done up close. Mm-hmm. And is it just reading individual letters? No, we have to piece the letters together to create words. The purpose of reading is for us to upload what it is that we're trying to look at the page. There are four basic areas that I'm looking for when I see it, and whether it's a child or an adult. The first part is making sure that their eyes are healthy and normal. The second part is, does this person need a pair of eyeglasses? And that's where most doctors will stop. The third part that I'm looking for is somebody able to use their two eyes together as a team? And the fourth part is vision or visualization, because vision actually occurs up here as opposed to here. The eye is a structure, and that's kind of like the TV camera, so to speak, that captures the light, but we do our visual processing up here. Kind of think of your computer, okay? The two main ways of getting stuff into your computer are the keyboard and the mouse. This is kind of like your keyboard, this is your mouse, and this is your computer, okay? You may have a good keyboard and mouse and a super duper computer, but if they're not well connected, you're not getting information into your computer.
So this process that the pediatricians use is a little bit more of a screening tool, correct?
Correct.
So then if there's a problem that may be occurring, that's when a more comprehensive evaluation is done. And then you may detect something that's going to require this retraining of the visual system.
Exactly.
So what's involved in the evaluation process, being a child or a kid, an athlete post-concussion, or even an adult that has vision problems?
The first part is to make sure that the eyes are healthy and normal. And seeing if I can help somebody with a simple pair of eyeglasses. What I'd like you to do, Dave, is I want you to put one palm up like this, okay? And put the other palm facing the other direction. Now, if you want to be able to use the two together, what would you do with your hands? You'd bring them in together, okay? So this is kind of like seeing the information from my right eye. And this is kind of like seeing the information from my left eye. So when I'm looking at something, whether it's reading or watching a ball being thrown, I have to first use the two eyes together. When we read, we have to lock on. In the same way that I'm looking at you and you're looking at me, we're fixating on one another. So when somebody's reading, they have to maintain fixation on the word. They then have to leave that word and then jump to the next word. They have to follow across the page. they have to fuse the two images, and they have to physically focus, kind of like when you're focusing a camera. If I can't maintain that, then it makes it difficult for me to upload. If I can't easily upload into my computer, then it's going to make it difficult for me to download. Now, I may use other ways of getting stuff into my computer, so to speak, okay? Kind of like a DVD drive or a USB port or a scanner, okay? So in the same way that we have other senses, we have different ways of getting stuff into our computer, but the visual system is the major way of getting things into our computer.
So people have compensations then. They may use other senses to do that. So when you're actually doing the evaluation, is there some technology you use or some special thing to see that they're having this problem to start focusing on the retraining?
When we identify that someone has a problem, then they go into a functional vision evaluation. And this is a battery of tests. These are perhaps 30 to 40 different tests, and typically takes about an hour to an hour and a half. And what we're looking for is how is someone using their visual system? Are they age appropriate? Are they able to input information easily? Are they then able to process that information? Some of the tests are observational, which means we're looking at how somebody's using their visual system. Some of the tests are normative, and what that means is similar to taking the ACTs or the SATs or the NJAS type tests. We're comparing one individual relative to thousands and thousands of individuals. So particularly if somebody's having difficulty, it may be a child that's having difficulty with schoolwork, with reading, with learning. Sometimes it's children that have been misdiagnosed as having dyslexia, or misdiagnosed as having ADD, or misdiagnosed with a learning disability. Often there's a visual component. Solve the visual component and many of these problems go away. After someone suffered a concussion or a brain injury, it's often difficult for them to use their two eyes together as a team. Difficult for them to then track across the page. Difficult for them to physically focus. And if I have difficulty in those areas, then I can't maintain my attention here. And therefore, I'd rather do something else.
So let's talk about, you mentioned a few things. One of them is the learning-related visual problems, or the ADD or some other educational disability. What are some of the treatments that you utilize for that particular segment?
There's a program called Vision Therapy, and it's a curriculum, kind of like a school curriculum, whether it's in third grade for world history, or it could be a college curriculum for physics. And there's certain things, certain skills that we build. And there are things just like in school. This is what we need to do first week in September, second week, third week. So by the time that we reach November, we're talking about pilgrims. And here too, first part is making someone aware that they've got two eyes in their head, and making them aware that they're often seeing double. What do you mean by seeing double? Well, Dave, what I'd like you to do is I want you to put one thumb in front of you, and you can do this at home as well, okay? And now I want you to put the other thumb a little bit further away, okay? So one thumb for perhaps at 8 inches, okay, a little bit closer, okay? And the other thumb perhaps at 2 feet. What I'd like you to do is I want you to look at this thumb. While you look at this thumb, what do you notice about the other thumb? The one that's closer to you.
It's blurry and it looks like 2.
Looks like 2. Excellent. So you've got 2 thumbs on your right hand. Now, look at your closer thumb. While you're looking at your closer thumb, what do you notice about your further thumb?
That's blurry, and I think I have 2 thumbs on that hand.
So you've got 4 thumbs altogether. What we've just learned is when you look at something and you point your eyes in, you have to be able to use your 2 eyes together. And everything else, all of the time, is doubled. And it's that difference between the two, that's how we judge depth. That's how we judge how fast a ball is coming at us, or how much distance there is between us and the car in front of us. So we know we use our visual system to drive our muscle system. So when we see the taillights on a car, we have to figure out, do I have to slam on my brakes, or can I apply my brakes gradually? So the visual system tells us how to send signal to our motor system, our muscle system, so that we can react properly.
So this is basically rehabilitation for the eyes, right? So you're retraining the eyes to be able to focus two together if necessary.
Correct.
Is there, obviously there's conditions in which the two eyes aren't coordinated very well.
Exactly.
Or they're having trouble coming together when something's very close. Can you explain that process?
Correct. Excellent. Okay. At times we have two eyes pointing straight, and that's what we're looking for. At times an eye may want to turn out relative to the other.
Because it's controlled by muscles or something?
It's muscle,
okay.
But if you think about it, what controls the muscle?
The brain.
The brain, exactly. Okay, so the muscles may be strong enough. It's not a muscle problem per se, but a coordination issue. Okay, so if I have one eye that turns out most of the time, or turns in most of the time, I may actually see double. So I may need to use additional effort and energy to bring my eyes in. I only have 100% of my energy. Okay, if I now have to use 20 or 30% just to bring my eyes in, then I have less left over for processing, for making sense. I'm kind of like working too hard. Kind of think of a 4-cylinder car that's only running on 3 cylinders. Okay, it still has all 4 cylinders. The eye is still healthy, but it's just not functioning real well.
Most of us think that the eyes are, they're controlled by the brain, and some of it is just reflex, correct? And some of it is motor function and planning. Are you able to train both of those systems, or is it just a motor?
Definitely, because vision doesn't happen here. Vision occurs here. If we can't use our two eyes together, and the first part of vision therapy is learning how to use the two eyes together and tracking and physically focusing and maintaining fixation. And the next part of vision therapy is making sense of what we're seeing. At times, someone, if they have an eye that turns out or turns in, they don't even realize that, because inside their brain, they just turn that information off. That's called suppression.
Got it. Now, in terms of some of the other conditions, so somebody has double vision or maybe cross-eyed, or you mentioned one eye is kind of off. Is that a lazy eye, you would call that?
Yeah, often lazy eye is misunderstood. There are actually two different processes. One is an eye that turns in or turns out. Lazy eye means because my eye is turned in or turned out, or if there's a large difference between the two eyes, my brain just turns that off.
Okay. So you would have some special techniques or things for them to do at home. They would come into the office and retrain that system. And then is there some kind of carryover to work with that at home? Or
Definitely.
How would they do it? Okay.
Vision therapy is a process that we learn in office. It's reinforced with home therapy. And as someone progresses, they move along and they gain more and more skills. It's kind of like learning how to play the piano. You can go in for the lesson, but you have to go home and you do what? You have to practice. And if you don't practice, you're not going to get better. So the first part is learning where to put my fingers. And the second part is starting to play the scales. And the third part is twinkle, twinkle, little star. And I have to move up the scale, so to speak, before I can play Beethoven. And vision therapy is somewhat similar. Start out with basic visual skills, and then we build, and we build, and we build until a person gets to the point where they own the skill. We don't have to wait until the end before we see the results. Usually within about 2 months, we start to see the benefits, and the carryover is from the therapy room into homework, into the football field, into being able to hit a baseball, and to be able to read and do my homework.
Good.
And the idea here is not to build skills that are exclusive to our therapy room, but rather to generalize this, whether it's to sports, or to driving a car, or reading, or writing. It's very common for us to see someone who's had poor penmanship, and by the end of therapy, their handwriting has improved. We don't work on handwriting, but it's helping somebody use their visual skills much more effectively. Now this person knows where they are in space, and a side benefit is that they start to write more clearly.
Great. Okay, so when we come back, we're going to talk more about some vision therapy, in particular what Dr. Roth and I work on together in terms of post-concussion athletes.
Your seat cushion can be used to grant wishes.
Who said that? Hello?
Really can, you know.
You talking to me?
Sure am. Because the airline miles you earn and donate to Make-A-Wish can help send thousands of kids on their wish trips. So donate to Make-A-Wish today.
You really should, you know. You really should.
And give wishes wings. Because wishes work wonders.
Welcome back to You and Your Health. I'm your host, Dr. David Bertone. Our guest today is Dr. Moshe Roth. Dr. Roth and I are speaking about vision therapy and what can be done to help people improve their vision when a problem exists. Dr. Roth, again, thank you for coming to the show.
Again, thank you for having me.
So you and I work together on some athletes or non-athletes that have concussion. I typically will work on retraining their balance and coordination and increasing their aerobic activity and getting them ready for sport or daily activities. But some of them have these visual problems that are persistent, that's preventing a full recovery, and that's when you and I work together on those. So tell us about what you do, particularly with a post-concussed patient.
Again, the first part is to make sure that their eyes are healthy, make sure that we're not dealing with a retinal detachment. That's the eye structure part of that. Okay. The second part, often people who've been concussed, and at times when somebody's had multiple concussions, sometimes 1 + 1 is equal to 4 or 5. They're not cumulative. They're not 1 + 1 is equal to 2, but sometimes the effects are much greater. Often when somebody suffered a concussion, it might be because they've headed a ball when playing soccer. It might be because they've fallen off of a bicycle, for example. So it doesn't only occur on the football field, it can occur in other areas, but then it impacts learning. So what we're looking for is we're looking for, does somebody have the ability to use their two eyes together as a team? And when somebody suffered a brain injury, or a mild brain injury, which is a concussion, or an acquired brain injury, sometimes cerebral palsy or multiple sclerosis, where we see patients who've had brain injuries or surgeries and they've lost the ability. Here, with vision therapy or neuro-optometric rehabilitation, we enable them to regain the skills. I work closely within the Brain Injury Alliance of New Jersey on the Sports Concussion Committee because we see many children. It could be a young athlete, it could be middle school, high school, sometimes college. Sometimes it's a weekend warrior that has difficulty in now using their two eyes together, and it impacts their ability to catch a ball. Why? Because if I can't easily use the two eyes, I see one ball here and another ball here. If I don't judge this correctly, well, I can be physically hurt. And what we do in vision therapy is teach somebody or retrain someone how to use their two eyes together as a team.
Now, some of the things that I notice is that they may not have complaints of blurry vision or double vision, but their balance and their ability to control their body is impacted, and we know that's controlled by a couple of different systems. One of them is the visual system, and it seems to be the one that people have really difficult with in terms of controlling their body awareness. Just give me an example about some of the things you might do with these patients to retrain that.
Again, the first part of vision therapy is to realize that I'm seeing a different picture with one eye than the other, and then teaching somebody to use their two eyes together by giving them the awareness of physiological diplopia, and that's just a fancy term of becoming aware that I see a second picture. Another technique that we would use in the office is called the near-far heart chart. Essentially, it's kind of like a chart of letters for distance and a chart for up close. So when I'm looking off at a distance, I have to point my eyes straight ahead. And when I look at something up close, like reading a book, I have to point my eyes in. When I look off at a distance, like looking at the board, I have to relax the lens inside the eye. Everyone has a lens. And when I look at something up close, I have to physically focus. So when we do that type of exercise, we're training somebody to be able to go from the teacher to their book, from the board to their notes, to be able to do this accurately. If I can't do it accurately, then it makes it difficult for me to copy down from the board or take down all the homework that I need to do at home. If I have to use so much of my energy in pointing my eyes in, I have less left over for processing and understanding. And those are the skills that we work on in vision therapy. Most of it is in the third dimension. What do I mean by that? Well, think of a computer screen. A computer screen has a horizontal and a vertical, but it has no depth to it. So sometimes patients ask me, well, isn't the therapy going to be done on computer? Well, computer can be a part of the therapy, but it's certainly not the totality, because most of our world is in the third dimension. Whether we're driving a car or hitting a ball when playing tennis, all of that is done in the third dimension. In order for us to have virtual reality, we have to have actual reality to begin with.
Mm-hmm. So are there some technologies you might use? Are there things like light boards or virtual reality goggles or something to help train those systems?
We certainly use a light board, and we use big screen computers. Some of this is called a walking rail. We use different lenses, different prisms, so a person gains the ability of knowing where their visual system is and how to be able to upload and process and then download.
One of the things that we notice in the concussed patient is headache, right? And quite often they'll hit the back of their head, and we know that the back of the head, or that occipital lobe in the brain, helps control your vision. Is there a correlation between headache and vision problems in these athletes or these patients? And is there something that you can do to help with that residual headache?
Definitely. The back part of the head is called primary visual cortex. That's where 80% of the information comes in. Some of the fibers connect with the vestibular system that's in the inner ear. And what you talked about in terms of the dizziness, the nausea, the difficulty with balance, the reason that somebody has that is because there's a mismatch between the visual system and the vestibular system. And that's often why people get car sick or seasick. Helps somebody use their visual system a lot more effectively. And using a trampoline, for example, so that they build a sense of proprioception of where their body is and a sense of rhythm, because so much of what we do is rhythmic. We breathe rhythmically. We walk rhythmically. Our heart beats rhythmically. So we have to integrate our visual system with our other systems, with smell and taste and touch and hearing and the balance system.
Great. How about some people that are non-injured and just looking to improve their vision, say an athlete or a high-level athlete that's building hand-eye coordination? Is there a visual therapy component that you can work on for that?
Certainly. That's called sports vision therapy. There was an athlete, Fitzgerald. I'm trying to remember his first name. He was
the receiver for the Cardinals?
Exactly.
Yeah.
And what's fascinating about his story is when he was in first grade, he had vision therapy with his grandfather, who was a developmental optometrist, as am I. And when he started showing sports prowess, then his grandfather worked on sports vision therapy. And what's fascinating with Larry Fitzgerald is when he catches a ball, he actually closes his eyes. Why does he do that? Because he visualizes where his body is going to be and where his hands are going to be. And it's phenomenal, and that's how he got to the point where he was voted most valuable player.
Interesting. So do you have that component in your practice in terms of even high school or college athletes that can work on things to build that skill?
So we can have somebody who's who doesn't yet have the skills and get them to this point. We can have somebody who starts off here and get them to a higher point. Or a sports individual, somebody who's an athlete, they're already starting at a high level and getting them to an even higher level. And that's why most professional sports teams, whether it's the Yankees or football teams or basketball teams, often have a developmental or behavioral optometrist on staff. These people are worth millions of dollars, and helping them use their visual system so that now they can judge, how far am I from the basket? How much energy do I have to put on the ball in order to get it in? How can I better use my peripheral vision, my side vision? All of this is real important.
Mm-hmm. How about non-athletes, people with specialized occupations, say police officers or pilots? Is that another area in which vision therapy can be utilized?
Definitely. When somebody is a police officer, they not only have to be able to look straight ahead, they have to be aware of what else is going on around them. Just like an athlete, I not only have to be able to see centrally, but see peripherally. And what we talked about before is the primary visual cortex. After information comes in, it gets processed to different parts of the brain. We have a dorsal and a ventral, and those are just fancy terms for other areas of the brain that use our side vision and are able to process. So vision occurs here primarily or first, but vision is throughout the brain.
Mm-hmm. Now, somebody comes to you that requires vision therapy. Is that something that insurance would pay for, or is it costly? How does that work for a patient?
Wonderful question. Thank you. Insurance or medical insurance works with the definition of disease, injury, or illness. So if a person has a problem that the medical insurance considers to be a medical problem, then they will cover it. If they deem the problem to be an educational issue as opposed to an eye structure problem, they'll say, not our problem. And then at times people fall between a rock and a hard spot, between the insurance company and the school system. So if the insurance company doesn't deal with this, well, let me turn to my school system. And the school system says, well, if you have a vision problem, get a pair of glasses. But these are not problems that eyeglasses can solve. If somebody wears eyeglasses, think about it. Their eyes move independent of the glasses. Glasses focus light onto the back part of the eye, but they don't change how our eyes track across the page.
Great. Dr. Roth, thank you for joining us on the show.
Thank you for having me.
You heard about vision therapy and all the different components from our guest today, Dr. Moshe Roth. Thank you for joining us on You and Your Health. Until next time, I'm your host, Dr. David Bertone.